Hi. Today at the Art of Patient Communication, we will be interviewing Dr. Darshan Thumar, who is a very, very knowledgeable clinician and someone who I deeply respect and someone who I see eye to eye when we talk about ethics. So, Darshan, can you walk us through your journey starting from schooling in Gujarat? Like, what medium was it? And then when you went to dentistry in Bangalore, how was that transition going from your mother tongue to English?
I did my whole schooling in Gujarat, in Gujarati medium, so everything is in Gujarati. English was just a subject, which was actually my favorite subject, but apart from biology, I had my year 12 exams in Gujarati. Then things happened, and I ended up in Bangalore to do my dental studies. When I ended up in Bangalore, well, forget about English, the actual local language was totally different. As you know, we have different languages in each and every state in India.
Yes.
So that was a huge challenge itself, plus dealing with English, because either they speak their own native language there or English.
Yes.
And hello, I don't know any of them. So, well, I kind of managed to get through some English and Hindi. In university, everything is in English, as you know, and all my classmates and everyone speaks English. And most of them were from English medium school, so they were pretty good in English too.
Yeah.
I had really good friends. I had really good friends, and I have not had. I still have them. They're really good friends.
Thank God
And
for that.
they helped me a lot.
Yeah.
Well, if I tell you one thing, I remember when I started in anatomy class, when the professor is asking questions or he's saying something or like he's asking things, I know the answers. I know every answer, but I cannot express because I don't know English. So I have a friend next to me, and I'm poking him like, okay, go tell this, say this, because I knew the answer, and he knew the English. So
So that combination.
I actually used to tell him all the answers so that he can say it in English, but I couldn't even put my hand up because I was just embarrassed to even put it in a sentence. That's when I realized that this is going to be a bit tricky. This is going to be difficult.
Yeah.
Because writing part is okay, but the speaking part is also important.
So you could actually write okay in English.
Well, we can think and we can take our time and writing. I mean, you can write simple sentence, but speaking needs confidence. You see, you need confidence, and you need to know what you're talking about, and other person should understand.
Yeah.
Eventually, in the university, I had to learn just on the go, like every single day.
Yeah.
I would learn things, and I was quite aware of what I'm saying wrong and what others are saying, and I would kind of copy or like kind of learn from them.
Yeah.
My friends were really good in a way that you would correct me. I remember this particular incident, right? So it was in my final year when we were three of us in the prosthodontic department and on the table, and I said something, and it was, I think I still remember, it was word flattering or something like that.
Yeah.
And two of my friends laughed, right? Now, in that moment, I had two options. One, I get embarrassed and I feel ashamed and I don't say anything, right? And the other option was to accept it, maybe laugh on myself,
Yeah.
and then go ahead and ask, oh, so what is correct way to say it, or what is the correct word? And I did that.
Okay. Good.
So the laughing stopped, and actually one of my friends corrected me, and she said, oh, it's actually not this, it's this, and this is how you say it because it's a verb.
Yeah.
I'm like, oh, thank you. And I was very thankful that, she actually helped me to correct. And that was actually a big confidence booster for me. And from that time onwards, I made sure that I would never feel ashamed or embarrassed about it. I would just own it. And I'm going to ask, okay, so what it is? What is it? Can you correct me? So how do I say it? How do you use it? And guess what? Everyone around me became a dictionary for me.
Yeah.
They all became teacher for me. They all started teaching me
Yeah.
every single time.
Yeah.
And my friends, every time, even like, it was just like it was just so seamless that if I say something, and they'll go, "Oh, it's not this, it's that." I'm like, yeah, so this, and then I start continue talking. Do you know what I mean? Like, it's like a little a teleprompter, like a nudge, it's
Yeah,
like,
this way,
it's
yeah.
not this is how you say
Yeah.
it. It was just so natural. It
Yeah.
was just so obvious. And actually to date, my friends still correct me sometimes
Yeah.
if they notice something like that. Yeah, I'm always very thankful. That gives me confidence as well.
Of course.
And I felt that I was in safe environment,
Yes.
that I can make mistakes, and that actually helped me even more. That more mistakes I make, more mistakes were getting corrected.
Yeah.
And then I make sure that I don't repeat it again. After my studies, and like towards the end of my studies and internship, I was planning to sit the exams for Australian Dental Council.
Sure.
So obviously, as you know, we have to do English tests and things like that. So I
The
started
OET.
classes.
Yeah.
I did classes. I did a lot of classes, did a lot of homework. And, when I was doing internship, I would actually get newspaper. I would get an old newspaper from Junk and all the people who sell all the old stuff,
Yeah.
because it's cheap or free. I would read those papers. If any words, if I don't understand, I will mark it.
Yeah.
I have a diary, and I will write it down. And I have a dictionary. I would go to the dictionary, read that word, understand the meaning. And if I find a word, I read that whole page, all the words in that page, and on the other side. Because that's the only way I could get more
English vocabulary up.
vocabulary up, Because can you imagine like reading the whole dictionary? Like, it's
No.
just...
Yeah.
So it
remembering
was too
it and-
daunting.
yeah.
Yeah. So I think that's the only way to do that.
Yeah.
I would go back to that book and kind of cover the half and read the words. And if I remember the meaning, I will tick it.
Yeah. Wow.
If I don't, then I'll read it again and remember it. I'll make a word about it, or not a word, a sentence about it, or something like that. I still have that book.
Do you?
Yes.
I would love to see it one day.
I should have brought it, right?
Yeah, you should have.
Oh my
yeah,
God!
yeah.
Because I had two books, because I filled two books of that those words, and I was actually, because when we moved houses a few years ago, I actually showed it to my kids that, look,
Yeah.
this is how I learn English.
Yeah, wow. Like imagine going through that book now, Darshan, and it would be interesting to see like how much of it you just
all
know.
of them, pretty much all of them, of course, I know now.
Yeah.
English movies
Yeah.
with subtitles, news, everything.
Everything.
That helped me a lot.
You never called the call centers up
No.
to practice
I
English.
feel sorry for that. No, I didn't do that. No. But see, the thing is, like, everyone around me, professors,
Yeah.
everyone, like even in Bangalore, even on the road, shopkeeper, everyone speaks
Everybody,
English.
yes.
So that was like a good practice for
That's
me.
right. Yeah.
Actually, I think more practice, like confidently speaking English, and then you get speed as well.
Yeah.
And then you don't need to convert words and the sentences from your language to English.
Yeah, because that's what you do mentally.
Yes,
You're constantly
yes.
converting.
Yes,
And it may
yes.
not come out the same way.
No,
Because it
no.
may change the whole meaning
of
altogether.
course. Oh my God, you don't want to do that.
Yeah,
You
no,
don't want
that's
to do
right.
that.
And I think what you said, it's most important that putting yourself in the safe environment, that environment is extremely important. And I think the second thing that really is like striking with me is owning it and then creating that environment for you, because if you're not open to feedback, then everybody else is going to shut down. Nobody's going to come to you and
That's
say,
right. That's
Darshan,
right.
that you're saying this wrong.
That's right. Yeah.
Yeah.
And there will be people who would make fun or laugh or make you feel embarrassed or make you feel you don't know English and it's really bad. But, well, if it is what it is, then just own it and do something about it. And if you cannot do something about it, then accept it.
That's
It's,
right.
there's only two ways.
Yeah.
There's no other way, actually.
No, there isn't.
Yeah,
No, that's
yeah.
right.
So it is hard. 100% is hard.
Yeah.
As I said, there was that moment. It was really hard for me to decide.
Yeah.
But the moment I decided that I'm not going to feel ashamed and embarrassed about it, things changed.
Yeah.
Things change. But
Fantastic.
you have to have that push.
Yes.
You have to have that leap of faith and just go for it.
Just go for it.
Yeah.
Yeah. So Darshan, so this was India, right? And then you came to Australia, you did your exams. I think you would have done your English and then your part one in India. And then you came to Australia and you did your
Yes.
clinical exam here. So, how was that part? And even practicing in Australia once you graduated, how was that? Talking to the patients, what did you do there?
India, I finished my exam, my degree.
Yeah.
I worked a couple of years, and then I was straight away preparing for the exams and coming here. The moment I landed here, I thought that, oh, I know English and English knows me. We're all good. We're friends. But hello, there's another thing here. There's accent.
Accent.
No, there are accents.
Yes, not just one.
Because
Yeah.
you feel there is only people speak English here.
Yeah.
But no, there are people from different part of world, all the different countries, all speak English, but everyone has different accent. I remember this another story
Yeah.
that in ADA class, the training course,
Yeah.
in the afternoon, in the evening, we had 3 lectures. So first one was a professor from New Zealand.
Yeah.
Cannot understand anything. I just cannot understand anything. Second lecture was another professor from UK.
God.
Not UK, sorry. I think he had Scottish or Irish
Oh, yeah.
accent.
Yeah.
Oh my God, I don't know what happened in that lecture. I really don't know.
Yeah.
At the end, I was my mouth and my eyes were wide open. I'm like, what just happened? What did he say?
Yeah.
And the third was another specialist, like he was Malaysian or Chinese. I'm not sure, and he had different accent. So I just got into something even
Worse.
more
yeah.
than that.
Yeah.
What I expected.
Yeah. And I think it weighs heavy on you because you have paid all these fees to learn, to graduate, and then all of a sudden you don't
No, I
understand 3
know.
lectures
Yes,
in a
yeah.
row.
And I felt like the same class in first year anatomy,
Yeah.
where I knew the answers,
Yeah.
but I couldn't understand the question, or maybe I couldn't answer in English.
Yeah.
I felt exactly the same. I'm like, oh my God, what is this happening?
Yeah.
And then again, I had to decide, okay, now I'm here. I've done all this stuff, all the exams. Now I've got final exams to do, and I'm going to work here. If I want to be here, I need to really work hard on it. I just have to get on with it.
Yeah.
So I started again watching TV here
Yeah.
in Australia with the accent
Yeah.
and the news, especially with subtitles.
Yeah.
I used to share houses, and some friends, when we go out to buy stuff, groceries, or, Safeway was Safeway there back then.
Yeah.
The milk, in the milk bar or whatever.
Yeah.
I would ask them, can I talk? Can I talk to the person?
Yeah.
I would tell my friends.
Yeah.
And I'll just make a small talk or whatever and try to kind of practice
Yeah.
my accent or and see if they understand me or not. 'Cause
Yeah.
that's very important that people to
Absolutely.
understand me. If I understand other people, that's one part of the story. The other part is they should understand me. So I used to practice. And also, again, even when I was doing the training here,
Yeah.
I had really good friends. Again, different culture background, different countries, I mean. And we used to talk in English, and I learned a lot of accents and how the common words are and how to pick up some different nuances, like how they say these words differently. Because some of the words are pretty much same, right?
Yeah.
In English. I mean, how you say it in different accents.
Yeah.
So I learned all that and tried to be very, very observant, very aware. Because you're in a group of 5 people, maybe all 5 of them speak English, but in different way. To give you just an idea,
Yeah.
to learn the accent, do you know what I literally did? Is just copy. Literally copy someone.
Like how they roll their lips or
Yeah, because we don't learn that from childhood, like and like literally, like in few months, if I need to learn that, I just only option I have is to copy someone.
Yep.
So in news or whatever, in the TV show or people random or friends, you just kind of start copying some words or sentences and things like that, and that actually helped. after that, obviously, like English had to be even much more like stronger, right? Because in India, like you can kind of get away with broken English or like something which is might not be correct in
Yeah.
grammar, but here, like to get a proper meaning, you really have to have the proper English.
Yeah.
Right?
Like the pronunciation has to be spot on.
Pronunciation, the grammar, the way you put words together,
Together.
everything should be like, even the tone,
Yes.
everything has to be really spot on.
Absolutely.
Because guess what? We have another language in India. It's a body language.
Yeah.
We have body language.
The body
We
language.
can do a lot of things with our
With our
head,
head.
our hands, our face,
Yeah,
right?
that's
Because
right.
if we are speaking whatever,
Yeah.
we have body language to kind of, it's like an additional language going on at the same time,
That's right.
which is making the other person understand how we are feeling or what we're trying to say. Here, I realized that that's not the case here.
No.
So you really rely on the words, how you say it,
That's right.
you know, what you say, how you say. So the tone and the volume, the voice, the vocal, everything, vocabulary as well.
Yeah.
Yeah.
Like, where do you pull the words out to express exactly what you want to say?
Yeah.
I don't know if at Ada Darshan, because we were put in a training class, one of the English speaking classes,
Yes.
because in Hindi language, we don't have the difference in the v and the w. And they would make us say this sentence. Can you say the weather is very, very warm? Whereas in India, I would say the weather is very, very warm.
Exactly. That was, can you believe it? Like, it's just, I shouldn't say it was a few years ago, because it's still sometimes that comes out of me.
Yeah. Yeah.
And my friends, and actually even my staff, I'm so fortunate, even my staff at the moment,
Yeah.
we are all different backgrounds, right?
Yeah.
But they all are really like so nice, and like I'm very open to that as well. Same thing.
So
Like,
you're doing
please
the
correct
same
me.
thing. Yes.
Please correct me if I'm wrong.
Yeah.
That actually started. There's another story.
Yeah.
Okay. So when I was working in the hospital here,
Yeah.
up near Grampians,
Yeah.
we have all the people from countryside, and they use a lot of slangs.
Yes. They
That's
do.
another
Yeah.
layer.
Yes.
Right? A lot of slangs, words, and like some idioms and things like that, right? So I didn't understand a lot of those at that time. And then I will quickly look at my nurse, and she will translate
Yeah.
in talking that this is what the patient means. I had to be vulnerable, and I would say to the patient, I'm sorry, I didn't understand. Because one time the patient said something, and I was thinking, and he said, you don't understand, do you? I'm like, no, sorry. And then he said that he translated that to me.
Oh, yeah.
So that was
Nice.
very nice.
Yeah,
Yeah,
that is
again,
nice.
same experience. I remember that patient still.
Yeah.
I remember the word.
Yes.
It was home stretch. So I
Home
was like,
stretch. Oh, yeah.
okay, what is it?
Yeah.
What does it mean? So
Yeah.
so he explained to me, and like, oh, thank you. Yeah. Then I was very open and honest about it. Can you explain me that? So still now, my staff also, they correct me a lot of the times, especially this W and V is, oh my God.
Does my
Because
head
the
in.
alphabets we have is different to what
Yeah,
English alphabets
we only have
are.
w.
So exactly, and some of like, we have t and t, it's very T sound, T is pronounced in two different ways.
Yes.
Like D is pronounced in two different ways.
Yeah.
So that was something I had to kind of, it's kind of, you literally have to separate
Yeah.
two languages. You cannot merge,
Mix them.
you
No.
cannot mix them, or you cannot translate and
Yeah.
things like that. You literally have to, like, I think someone who is really getting into this and trying to learn and like get into this journey,
Yeah.
the best advice I would give is that just separate it. Do not mix it,
Very true.
because the moment you start mixing it, is very
It's a mess.
difficult. It's a mess.
Yeah.
Yeah.
And that's what
makes
most people do.
Yeah, exactly. It's just out of unconsciousness.
Yeah.
Unconsciously, they do it out of habit.
Yeah.
But you have to be really aware of it. You have to be very, very aware of it, and try to learn English as English,
That
not
is
a
so true.
translation of some other language.
Yeah, well, I never thought like this, but that is so true though. It's like that's where we all go wrong, when, for example, when we ask the veggies,
Oh my
most dentists would
God.
say veggies.
Oh
They're
my
like,
God.
what vegetable you're after? That is a running joke in our clinic.
Why do you want to put vegetables in patient's mouth
Exactly.
right now when you're doing a filling?
Feeling exactly. God,
It makes
yeah,
so funny
it is funny. God,
funny
yes,
stories.
yes.
My God. One more thing actually I learned over the period of time is that okay, for example, people have learned English,
Yeah.
right? Okay, but they cannot get the accent.
Mm.
They cannot get the original accent out.
Yeah.
They cannot get the true Australian or American accent. It's fine.
Yeah.
I would always say to the people, do not worry about accent.
Mm.
Actually, even Win
Yeah, Vin.
Jiang,
Yeah.
actually even said that, and that
Yeah.
was amazing. Actually, that
Yeah.
if your pronunciation is clear, it doesn't matter if you have accent or not,
Mm.
right?
That's right.
And you see a lot of speakers, a lot of leaders, they have accent, but the message is clear.
Yeah.
As long as the message is clear, and also if you believe in what you're saying, if you're saying with conviction, the other person will understand. Yeah.
Yeah.
I still believe there is always body language, regardless wherever
yes.
you are. Even if you don't move your hands too much or your face or head or anything, your eyes always talk. And if you are saying something, your message shows that conviction and really the belief that in what you're saying, it will get through to the
It
other
will get
person.
through.
Yep.
Has to come from
I
heart,
totally
isn't it?
believe it.
Yeah.
I totally believe it. And I've seen it many times as well. And I would say this to anyone who is going into this journey, that just trust yourself and believe in what you're saying, because that will come through. Sooner or later, it will come through.
Yeah.
Do not worry too much about English and the correct pronunciation, and it will come, but just
Hang in there.
yeah, just communicate with determination, communicate with a purpose,
Yeah.
and communicate with strong belief that what you're saying is you actually mean it.
Yeah.
Yep.
That's
Definitely.
great. Now, Darshan, you are a very successful business owner and a very, very talented dentist.
I'm trying.
Yeah, you're doing really well. Your patients love you for who you are. I want to know that because you are a business owner and because you are someone I really see eye to eye with the ethical thoughts. So I want to know, how do you keep those two things distinct in your mind when you are running a business, that you have to make sure that the business is profitable, and secondly, keeping the patient in the center and keeping those ethics in check all the time?
Well, we learn every day, right? I got into the business just by, it wasn't a plan or anything. It just happened to me. And then I learned a lot on the way. I got few business principles for myself. I would just share maybe two or three of them. The big one is, I'm saying it correctly, win, win, win.
You are. Yeah.
It has to be a win-win-win situation for everyone.
Yeah.
The patient, the provider, the clinician, and the practice. Right? I feel that when this triangle is completely balanced,
Yeah.
things will go fine. Everything will be right. Yeah. And it's never, if you're just thinking about, if one person is only thinking about one person's benefit, then the triangle is skewed. And then sooner or later, there will be imbalance. So I always try to have the patient side, the clinician or clinicians side, and the business or the practice side, or even staff is also included in that. So everyone has to have win-win-win situation. That's one of the big principle I always work on. I always keep in mind. The second one is, I always think long term. Short-term pain for long-term gain, because short-term, no matter what I have to do, it's okay. If I have clarity about my long-term goal, I'm happy to work harder or go through some difficulties in short term. It's fine. But I always train my staff and even my kids, or that it's okay. Don't worry about right now. Think about long term, And the other thing is, do the right thing in the first place. Being honest and doing the right thing. It's like integrity, that you're doing the right thing when no one is looking at you.
Yes.
So if you do right thing, even if the result might not be there straight away, it will come later. And I can sleep.
Sleep well at
I can
night.
sleep well that I've done right thing. Whatever happens
Yes.
after that, it is what it is.
Yeah.
You know. For example, I will give you example like as in one of my patient many years ago. I did braces for her.
Yeah.
Adult patient. She was physiotherapist, and I finished the case. It took a while, and finished the case, and then she was quite happy with the whole procedure, everything. She was very happy with the result. And then I saw her in 3 or 6 months' time for a review or something like that. And I had a look at the bite and everything, and I thought, oh, I can actually do better. I think there's still room for improvement, and I can improve this. And I discussed that with the patient. Patient actually couldn't care less, really. She said, "Look, I'm fine the way they are, but if you're willing to, if you want to do something and make it better,
Yeah.
I'm happy with that." And I said, "I wouldn't charge you for anything,
Yeah.
but if you allow me to put braces on again, I will make it even better."
Yeah.
And she was kind enough for me to do that, and I did it, and then I fixed the bite and made it even better. And she was quite thankful. First thing that I felt better, that okay, I did something and I was happy with my work, because I could have just kind of ignored it.
Of course.
Because even when I looked at it, I'm like, oh, it's not the way it should be, or I can do better now. Now, because sometimes you look at the same thing another day, it looks different.
Yeah.
And then patient was happy too. And then at least I have spent that extra time and money from my side. But it's been 14 years. Patient still comes and see me. Her husband, I'm actually doing treatment for her husband now. They've got a daughter. And every time she comes, she will come and hug me. And, she knows, sometimes we
Yeah.
get back issues and all. She's a physiotherapist. So
Yeah.
she brings me some foam roller and this and that. And every time she comes me and checks, make sure that I'm doing my exercises and all that. So she's very dear patient, the whole
Yeah.
family. And oh, by the way, her brother, her mother, her father, everyone is our patients.
Yeah.
So it shows that, I just went through that second lot of treatment, not expecting all this, but it just happened
Yeah.
over the period of like years I'm talking about.
Yeah.
So it's okay.
Yeah.
It's fine. The thing is that even if her family wouldn't have come to see us, or she wouldn't have been back
Yeah.
at all after that day, I'm still fine with that.
Yes.
I wasn't expecting anything anyways.
I think for you, it was like giving the treatment that you promised her
Exactly.
and being
it's
honest about it.
Exactly. My integrity, I was honest about that, and I was happy to correct it at no charge, because that is my reflection of my work. So again, you can actually even apply this win-win-win rule in this situation as well, so
Yeah.
that I won, patient won, and the practice as well.
Yes.
Because now practice has retained the patient,
Yeah.
has more people, like new patients coming in. I have my integrity and honesty and my clinical standards maintained, and patient is happy too.
Yeah. Do you know, Darshan, you just said that you had that conversation with the patient about how you thought that you could have done better. As a clinician, and in our practice, and that's why it's called a practice, because we are practicing every single day to get better. And it happens on a day-to-day basis that you would have done a procedure or a filling, or whatever profession you are in. I feel like there's a lot of people who have that reluctance of that 1 second, because they know what's a good product, but they have that reluctance to confront it to the patient and say, sorry, look, I could have done better. Can I see you again? Or did you go through that maths in your head before you said that to the patient? Because I think a lot of people just stop there and they somehow rationalize it and move on from that error and never go back and fix it. And that was their opportunity to get better, but they never did. So how do you actually, what's the dialogue? Tell me your internal dialogue.
So it's very, very good point. It's
Yeah.
very important,
Absolutely.
and it's very observant of you to even think about that, because you're right, because we get this dialogue happening in our mind, whether should I tell this to the patient or if I say this, would the patient think that you don't know what you're doing? Or patient might think that how could you not fix it well in the first time? Multiple scenarios, right?
Or I will look less of
Oh
me.
yeah, of course, yeah.
Yeah.
But see, that's the thing, that it's you you have to be clear in your mind first about yourself. If my values are integrity and honesty, then I need to really work on that, and I need to really practice, right? I really need to actually do it, even if it's hard.
Yeah.
You still have to do it. The reason that I would say that to the patient, that if I don't, then I would always have that guilt that every time I see that patient, I would have that guilt that, oh, I could have actually fixed it. I could have done that before.
Done it
The
better.
longer I leave it, harder it becomes. And I don't want to have that type of
Wait.
weight, and because that conversation becomes more and more difficult. Because if there is more years pass, and then I
Yes.
say after 5 years, do you know what I mean? So I think that was the push that I had in that moment, that I need to tell the patient right now that this is something I could improve upon, and we could achieve even better result. And again, this is an option, you see. It's an option. So I'm discussing this with the patient, that this is what I feel, this is what I could do, what do you think? I'm not imposing or forcing patient to do it. As I said, patient couldn't care less. She was more than happy to leave it as it is as well.
Yeah.
So if she would have said that, no, I'm fine with that, I'm fine, because actually I've done my part. Do you know what I mean? I cannot force the patient, obviously.
Yeah.
So once I have done that, and if patient says, oh, it's okay, actually, I don't want to get braces again, fair enough.
Yeah.
Then my job is done. I have done my part.
Yeah.
So I can sleep well at night, that at least, okay, I've done my part.
Yes.
Things which I can control, I can control. The things which I cannot control is just out of my
your
hand anyway. So I
Yeah.
don't need to worry about it.
No.
Yeah. So I think in that moment, I think it's important to give options, as we all always do. Yeah, look, you can think all the negative things in that time, but just dust it off first and just think positive, that maybe this patient might appreciate that, and maybe might not even go for it, but at least we have done.
Our
And
part.
trust me, a lot of because I've done it a few times later on, sometimes feeling is a little bit
Yeah.
not the way it should be, or could have been done better, because
Yeah.
that time it was bleeding a lot and things like that, and then
Yeah.
you do it again, because
Yeah.
now I can do it better without any bleeding gums.
Yeah.
And I've done some repeat fillings
Of course.
without any
We all
charge,
do.
and
Yeah.
we always do, and patients really appreciate that
They do.
every single time. So sometimes we overthink too much, and we always think of the worst case scenario.
Yeah.
And that's quite human. I think everyone.
I think
is
we're all
like that.
wired
We're
like
all
that.
like that. Yeah.
Yeah.
But it's just looking beyond that, and actually not even letting it shadow our mind, that what could go wrong. Well, let's think what can go well.
That's so true. Yes. I'll
Yeah.
try to remember that. Thank you, Darshan, for joining us. It was lovely to have you here.
Thank you so much. I'm very honored to be here, and hopefully I've shared some insight from my experience and would help other people. Thank you very much.
Thank you very much, Darshan. Thank you for listening. I hope you got something out of it. Follow me on Instagram and subscribe on YouTube. Thank you.